had an extra cap put on his teeth, you know, for no other reason other than for them to charge it up. And, you know, there's no reason why, you know, with the, you know, the amount of revenue that our country makes, that we can't have the same standards of healthcare such as like England, France. You know, I mean, it was ridiculous. I mean, a good example is, you know, when I had the health coverage, when I was under my HMO, I was going and making a copay for, you know, a simple painkiller that was, I had to make a copay of $25, and the actual cost when I went and got the outbreak was $6. There's no reason, and I mean, especially with all the money that's being spent on the bailout and all the money that's being spent in Iraq, I mean, with all of that money, we should be in a much different ballgame. There's so much deception when it comes to, you know, the cases that, you know, the people that are against universal health care, is, you know, as far as saying, oh, well, you won't be able to choose your own doctor, you know, and such. I mean, it's just rhetoric. You know, it's just something that's, you know, it's being thrown out there to, you know, just kind of spook people.
And at this point, under Access, I work with homeless youth.
Right.
Some of my single teenage mothers, I had one young lady come and try to get an antibiotic for her daughter who had strep so badly that her whole body was rashed up. And she said, how do I stop this rash?
Well, that's dangerous.
And I said, you need antibiotics. She said, but they cut my Access because I didn't fill the paper out right. And they said, I won't be able to get medicine for at least 3 days.
Yeah, there's a lot of people in the middle as well that don't have, that are making just enough to where Access doesn't cover them.
Exactly.
But at the same time, they don't have work, you know, enough to where it's covered. You know, and then even the, you know, even the people that are covered by HMOs, I mean, I saw, you know, people getting much better treatment, you know, than when I got sick. Under my HMO, they basically wouldn't even run, they'd run the bare minimum of tests. And, you know, Access is a decent system. It covers the people that really need it. But at the same time, you know, I think universal health care to me is the answer. You know, there's no reason if it works in other countries. I mean, even in England, you know, as, you know, Michael Moore pointed out, they'll even pay your cab fare to go to the hospital.
In 2006, 22,000 people in America died because they couldn't afford health care. And those deaths could have been prevented if they had health care. 22,000 people died.
And probably more. Those are just the ones
that was in 06.
No.
So, you know, it's really kind of ludicrous to think that we're in this great country and people are dying for lack of insurance, for lack of care.
Well, and the other side is, everybody screams about if the government gets involved, you don't get to choose your doctor anymore, and you've got somebody making decisions and rationing health care. You've got rationed health care now. When health care is decided by how good your insurance is and how much money you've got rationed health care. And anybody that says not is lying through their teeth.
And God help the person with pre-existing conditions.
Oh God, yeah.
Or even somebody that has symptoms that look like pre-existing conditions.
Mental health.
And that was the next one. Blue Cross Blue Shield will only pay 50% of mental health care, and they pay 90% of health care.
Yeah, and who's not depressed about the way things are going?
I think we're all going to need some mental health care pretty soon.
Not only 50%, but there's lifetime limits.
There are lifetime limits, and there are limits to visits of psychiatry and counseling per year. So, I'm sorry, we need help. So let's go to Gabriel Giffords and ask for her to help us out, represent our needs, okay?
Sounds like a great plan.
Let's do this.